Hi, my name is Lara Schmitz. I work as a physician assistant in orthopedic surgery, specializing in the upper extremity. Today I'm talking about the Supersling. It's a sling with a waistband and a pillow for the arm that we use for complex shoulder surgeries, including rotator cuff repairs and shoulder replacements. I want to empower you to have the tools to adjust your sling at home. In the first day or two after your surgery, fitting the sling is not the priority. You should be in the sling, but you should be focusing on getting your pain under control, getting enough sleep if you're fatigued coming out of anesthesia, and making sure that you have ice on the shoulder. It's when you're starting to feel more alert, perhaps day 2, day 3, day 4, and you can provide a nice upright posture, that it's a good opportunity then to check the fit of your sling so that you can remain comfortable as you become more and more active. Components of your Supersling include the sling and shoulder strap, the exercise ball, an optional underarm side strap, your waistband, and the pillow. From the front of the body, you can see the forearm cradled in the sling, the upper arm held away from the body by a pillow spacer at the waist, and there are 2 secure straps at the waist and the shoulder. When looking from the back, the ring on the shoulder strap should not be located directly along the spine, but instead just offset toward the surgical shoulder at a comfortable place on your upper back. When your sling is adjusted to your comfort, the clip at the front of the waist belt and the clips attaching the shoulder strap to the sling are the only areas that need attention, and only when taking the sling on and off to shower. There is an extra clip on the inside and outside of the sling which you can hide in the pocket and zipper closed. Here's a look inside your sling. There is a small Velcro attachment for the thumb which is completely optional. There's also a Velcro attachment to support the elbow at the back of the sling, but if it's too bulky or getting in the way, you can remove it. Here's a close-up of the pillow and exercise ball attached at the front. Keep in mind that the Velcro tab for adjusting the waist strap may be located toward the back of the sling. If you are steady on your feet, this is how you can replace the sling yourself. Using a high table, gently lower your arm into the pocket of the sling, take the shoulder strap around your head, and then find and secure the waist strap toward the front of the pillow. Then you can make any final adjustments to the fit of your forearm in the sling. Don't forget to secure the Velcro across the forearm and make any needed adjustments for your hand. Now that you've mastered the traditional Supersling, I'll show you a quick variation to utilize your optional side strap. If you locate the ring at the front and the back of your shoulder strap, you can attach the Velcro tabs of the additional side strap, pointing the blue Velcro dot toward the front and the white Velcro dot toward the back, and securing this additional strap underneath your arm to further pull some of the tension off of your neck. Let's stop here. We've gone through all the basics of managing your Supersling. If you need to make any additional adjustments, this next portion is a little more complicated and will require your caregiver's assistance. If you have a family member or a friend, someone who is staying with you, who can adjust the sling either while it's on you or take it off, make some adjustments and try it back on. You do need 2 working arms to make these other adjustments, so you will need some assistance, and it does get a little more complicated. There are 4 additional Velcro tabs on the arm strap of your Supersling. I'll go through those quickly here. Tab 1 is located at the front. Slide the shoulder pad over. You'll find tabs 2, then 3 and 4. Keep in mind, if you're to adjust this without having the sling on the patient's body, we spoke before about where the back ring should land on the shoulder, off of the spine, but adjacent to the surgical shoulder. If you make these adjustments without comparing to how it fits on the patient, you may change where this ring will sit on the back, which could cause discomfort. So again, some troubleshooting, having an extra set of hands would be the simplest way to make these changes. Shortening a strap that is too long is easy if you remove the Velcro tab, cut the appropriate length off the strap, then replace the Velcro tab and readjust the sling on the arm. Best of luck and a strong recovery.